All India Radio presents Morning News. Good morning, I am Valsa Williams and with me is Tanvi Taneja. The headlines. Prime Minister Narendra Modi announces assistance of 1,000 crore rupees to West Bengal and 500 crore rupees to Odisha for relief and rehabilitation in cyclone-hit areas. COVID-19 recovery rate improves to 41% in the country. Government revises advisory to use hydroxychloroquine for asymptomatic healthcare and frontline workers. Air India resumes booking for domestic flights. ICSE remaining Class 10th and 12th board exams to be conducted from 1st to 14th July. Community radio network to be expanded in the country, says Information and Broadcasting Minister Prakash Javadekar. Prime Minister Narendra Modi has announced 1,000 crore rupees assistance to West Bengal and 500 crore rupees to Odisha for relief and rehabilitation work in cyclone Amphan affected areas of the two states. The Prime Minister announced the assistance package for West Bengal at Boshirhat in North 24 Parganas district after an administrative meeting yesterday. The meeting was held to assess the extent of damages caused by the supercyclonic storm. The Prime Minister also announced 2 lakh rupees compensation to the families of each victim killed in storm-related incidents.
भारत सरकार के जो भी नीति नियम है उसका पूरी तरह उपयोग करते हुए पश्चिम बंगाल की मदद में हम खड़े रहेंगे। अभी तत्काल जो इस संकट की घड़ी में राज्य सरकार को कठिनाई न हो इसके लिए एक एडवांस असिस्टेंस के रूप में 1,000 करोड़ रुपया व्यवस्था की जाएगी। साथ साथ जिन परिवारों ने अपने स्वजन खोए हैं उन परिवारों को प्रधानमंत्री राहत कोष से 2 लाख रुपया और जिन लोगों को इंजरी हुई है उनको 50,000 रुपये तक की सहायता देने का भी हम प्रधानमंत्री राहत कोष से करेंगे।
The Prime Minister also informed that a central team will arrive in the state soon to assess the damages. Earlier yesterday, the Prime Minister, accompanied by West Bengal Chief Minister Mamata Banerjee, made an aerial survey of the cyclone-hit areas in the state. The Prime Minister also announced 500 crore rupees assistance for Odisha yesterday. He also announced an ex gratia of 2 lakh rupees to the family members of the deceased and 50,000 to the seriously injured in the cyclone. The Prime Minister made the announcement in Bhubaneswar after holding a review meeting.
तत्काल आवश्यकता को ध्यान में रखते हुए भारत सरकार की तरफ से 500 करोड़ रुपया एडवांस व्यवस्था के रूप में देने का हमने निर्णय किया है और बाकी आवश्यकताएं एक बार कंप्लीट सर्वे होने के बाद रिहेबिलिटेशन की पूरी योजना बनने के बाद भारत सरकार भी कंधे से कंधा मिला करके ओडिशा के विकास की यात्रा में और इस संकट की घड़ी से बाहर निकलने के काम में पूरी तरह मदद करेगा।
Health and Family Welfare Ministry said that a total of 48,534 people affected with coronavirus have been cured. The recovery rate has reached around 41% in the country. Briefing media yesterday, Health Ministry officials said that during the last 24 hours, 3,234 people have recovered. He added, case mortality rate has also improved in the country to 3.02%. The ministry official further said that the government is focusing on the worst affected districts in coordination with the state governments.
हमारा फोकस उन स्टेट्स और डिस्ट्रिक्ट्स पर है जहां पर ये ज्यादा केसेस रिपोर्ट हुए हैं। हम स्टेट्स के साथ मिलकर वहां पर कंटेनमेंट और क्लिनिकल मैनेजमेंट ऑफ केसेस पर फोकस कर रहे हैं। आज जरूरत है कि हम सब मिलकर रिक्वायर्ड प्रिकॉशंस लेते हुए इस इन्फेक्शियस डिजीज से अपने आप को और अपने परिवार को बचाएं।
Indian Council of Medical Research, ICMR, said a total of 27,55,714 tests were done till 1 p.m. yesterday. Within 24 hours, 1,03,829 tests have been done by the various government and private laboratory chains in the country. Member Health Niti Aayog, Dr. V.K. Paul said 1 crore treatments have been done under the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, which is a great achievement. He said 14,000 health and wellness centers have been commissioned so far. He added, the decision of lockdown has been taken in a timely manner and it proved beneficial for the public to restrict the expansion of coronavirus in the country. Mr. Paul said the doubling rate of COVID-19 cases was 3.4 days when lockdown was started, and it is now 13.3 days. Mr. Paul added, current active cases are concentrated in a few states, cities and districts, and 80% of cases are in 5 states: Maharashtra, Tamil Nadu, Gujarat, Delhi and Madhya Pradesh. He said the lockdown proved gainful in terms of preparedness. He added 10 crore people are using Arogya Setu app and telemedicine is increasing day by day. The Health Ministry yesterday issued revised advisory for use of hydroxychloroquine HCQ as prophylaxis preventive treatment for COVID-19. Under it, HCQ has now been recommended for asymptomatic healthcare workers in non-COVID settings also, and for all asymptomatic healthcare workers involved in containment and treatment of COVID-19.
I am aware that I am entering this office at a time of global crisis on account of this pandemic. At a time when we are fighting to simply stay alive, and at a time when we all understand that there are going to be many urgent health challenges in the next 2 decades. All these challenges demand a shared response because these are shared threats requiring shared responsibility to act.
That was Union Health Minister Dr. Harshvardhan, who yesterday took over as the chairman of the World Health Organization WHO Executive Board. Dr. Harshvardhan has been elected as the chair of the Executive Board of WHO for the year 2020-21. He replaces Dr. Hiroki Nakatani of Japan. Addressing the board through teleconference, Dr. Harshvardhan called for a shared response from member countries to tackle the COVID-19 pandemic. Highlighting India's efforts in tackling COVID-19, he said the country faced COVID-19 in a proactive and preemptive way on an unmatched scale and with determination. The Executive Board of WHO is composed of 34 technically qualified members elected for a 3-year term. The main functions of the board are to implement the decisions and policies of the Health Assembly and advise and facilitate its work. In our series Experts Speak on All India Radio, we bring you views of leading medical experts on COVID-19. Talking to AIR News, Dr. Amarchand Bajaj, Senior Consultant in Sitaram Bhartiya Institute of Science and Research, New Delhi, highlighted the importance of hygiene and how to maintain it to contain novel coronavirus.
जब तक हमारे पास इनकी ट्रीटमेंट वैक्सीन या मेडिसिन के रूप में ना निकले, तब तक हमें जो प्रिकॉशनरी मेजर्स है वो फॉलो करने हैं। जहाँ जरूरत ना हो उसमें घर से बिल्कुल बाहर ना निकले, कोशिश करें कम से कम बाहर निकलना है। और जबकि निकलना भी पड़ा घर से बाहर तो कोशिश करें कि जहाँ आप 2 लोग खड़े हैं, करीब 2 मीटर दूर खड़े रहें, नहीं तो कम से कम 1 मीटर दूर खड़े रहें।
Dr. Naresh Gupta of LNJP Hospital, Delhi, said that in most of the cases the COVID-19 infections are self-limiting and very few patients are required to take admission in hospital.
अगर इंसान को एक्सपोजर है उस इंसान के साथ जिसको कि कोरोना वायरस देखा या भुगता है तो उसका कोरोना वायरस होने का चांस है। कॉमन कोल्ड और कोरोना वायरस इन्फेक्शन दोनों की दोनों आमतौर से अपने आप ही सेटल कर जाते हैं। 80% में तो ऐसी भी तकलीफ नहीं करते हैं या इतनी हल्की करते हैं कि लोग घर पे ही ठीक हो जाते हैं। 10-15% में उनको अस्पताल जाके कुछ दवाई दी जाती है और वो सेटल हो जाते हैं। 5% या उससे कम वाले हैं जो कि दाखिल होना पड़ता है। तो फर्क आप नहीं कर पाएंगे, सेटल आप हो जाएंगे।
Union Minister Dr. Jitendra Singh has said that post-COVID India will emerge as more confident and gain esteem in the world arena. Dr. Jitendra Singh was speaking to a TV channel in an interview. Dr. Singh said, notwithstanding all the apprehensions in this hour of crisis, he is confident that in 6 months the world will look up to India with respect and seek to engage with us. Not only this, he said India will also emerge as a safe destination for business and trade. Dr. Jitendra Singh also observed that early lockdown announced by Prime Minister Narendra Modi had helped India to train itself for the new norms of post-COVID world.
Information and Broadcasting Minister Prakash Javadekar has said that the ministry will come out with a plan to increase the number of community radio stations soon. He said 75% of the expenditure for setting up of community radio stations is borne by the ministry. Addressing listeners of all community radio stations through All India Radio News yesterday, Mr. Javadekar said community radio is a community in itself and they're all agents of change.
scheme for expansion of community radios. This is a very major tool of people's transmission, and we want to encourage this, and therefore I will ensure that the plan is unveiled very soon than later.
Mr. Javadekar added the government is eager to raise airtime for advertisements to 12 minutes from the 7 minutes per hour right now on community radio stations to bring them at par with TV channels. On the key demand of community radio of broadcasting news from their platforms, the minister assured that he will consider it. He prodded the stations to play a key role in combating fake news menace by verifying it through local sources. He invited stations to share it with All India Radio so that the reach of the truth can be amplified. He added that the ministry has created a fact-check cell under PIB and community radio can complement the role of the fact-check cell. Mr. Javadekar said that fake news is very dangerous and should not be considered as part of press freedom. He stressed on the crucial role of community radios in countering fake news by giving correct information verified at the local level.
Fake news is not press freedom. Fake news are very dangerous, and therefore we must stop fake news at the root. And therefore we are having the PIB fact-check unit which verifies the facts, and community radio also can do by verifying the facts with their local contacts and immediately repair it, because that is the big and very important national duty to be performed.
Exhorting people to keep up their fight against coronavirus, the minister said we will drive it away the way we have driven away other diseases. He stressed on the 4 steps to keep themselves safe by staying at home, frequent washing of hands, wearing face masks in public and maintaining social distancing.
Finance Minister Nirmala Sitharaman has stressed the need to make the country self-reliant. She said imports should be possibly made within the country, but the country still has to import goods which help produce both for the country itself and also for exports. In an exclusive interview to Doordarshan News, Ms. Sitharaman said the way the government has designed the package, it would give immediate help to all those who need additional capital in order to kickstart the economy. She said it will benefit both the demand and supply side. On the call for restarting the economy during the epidemic, Ms. Sitharaman said that she has kept open all options with reassurance that the government is ready to help. Talking about the RBI's recent decisions, Ms. Sitharaman said they have been very timely and made a lot of difference to the sentiments which prevail and also immediately make available affordable liquidity.
The RBI decision, not just this one, even earlier, have been very timely, well thought through, and made a lot of difference then, and I guess even now will make a lot of difference to the sentiment which prevails, and also immediately make affordable liquidity available. And also the extension of the moratorium is something which all of us have waited for, and I only welcome the decision of the RBI. Like the last time, this time too, timely and purpose-serving.
Ms. Sitharaman also thanked Prime Minister Narendra Modi for taking bold decisions to free farmers of historical shackles. She said farmers can now choose to whom they want to sell their produce.
You are listening to the morning news on All India Radio. Before we move on, a reminder of the headlines. Prime Minister Narendra Modi announces assistance of 1,000 crore rupees to West Bengal and 500 crore rupees to Odisha for relief and rehabilitation in cyclone-hit areas. COVID-19 recovery rate improves to 41% in the country. Government revises advisory to use hydroxychloroquine for asymptomatic healthcare and frontline workers. Air India resumes booking for domestic flights. ICSE remaining class 10th and 12th board exams to be conducted from 1st to 14th of July. And community radio network to be expanded in the country, says Information and Broadcasting Minister Prakash Javadekar. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
The Council for the Indian School Certificate Examination CISCE has announced that it will conduct pending Class 10th and 12th exams from the 1st to the 14th of July. Exams were postponed due to the coronavirus-induced nationwide lockdown. CISCE Chief Executive and Secretary Jerry Arathun said while the exams for Class 12 students will be held from the 2nd to the 12th of July, Class 10 students will appear for exams from the 1st to the 14th of July. He asked schools to ensure social distancing is followed and directed candidates to carry hand sanitizers and wear face masks. Air India has started booking of tickets for domestic flights from yesterday. In a tweet, the airline informed about it. Many private carriers like Indigo, Vistara and SpiceJet have also resumed bookings for domestic flights. They have started accepting bookings on their websites. Earlier, the government had announced that domestic flight operations would restart from Monday in a calibrated manner. The flight operations were suspended from the 25th of March due to the imposition of lockdown in view of the COVID-19 pandemic.
Union Minister Ravi Shankar Prasad has instructed India Post to work towards realizing the vision of Prime Minister for an Atmanirbhar Bharat. The Minister of Communications, Electronics and Information Technology stressed on the need to provide logistics support for Indian systems of medicines that include Ayurveda, Unani, Siddha. He said India Post should prepare a strategic plan to become the flag bearer of Indian supply chain through which agri-products, handicrafts, artisan products can be delivered. More from our correspondent.
India Post has taken several steps to deliver essential items during the lockdown. In this period, India Post, with its vast network of 156,000 post offices, delivered mails and medicines, provided financial assistance at the doorstep, and distributed food and ration to needy people. More than 2,000 tons of medicines and medical equipment were delivered to individuals and hospitals across the country. Around 1,500 crore rupees disbursed to around 85 lakh beneficiaries using Aadhaar-enabled payment system of India Post Payment Bank. 6 lakh food and ration packets were distributed to labourers and 1,100 crore rupees disbursed in beneficiaries' account through direct benefit transfer. With Dipendra Bhupen Singh, AIR News, Delhi.
In Gujarat, the state government yesterday announced some more relaxations in order to normalize public life during Lockdown 4. Our correspondent reports that the odd-even formula for the opening of shops in non-containment zones will not be effective on shops providing essential services. Petrol pumps on the highways can operate round the clock in the state. The government has allowed dairy collection and dairy processing sector to operate from 7 in the morning to 7 in the evening. As many as 392 patients were discharged from various hospitals yesterday in the state. The number is higher than the 363 fresh cases that were reported from the state. The total number of cases in the state rose to 13,273 yesterday. More from our correspondent.
The State Health Department said the recovery rate in the state has improved to 44.3%. The state still has 6,588 active patients of COVID-19, out of which 63 are on ventilator support. The mortality rate in the state remains alarming. The death toll crosses 800 mark yesterday. Meanwhile, the recovery rate in Ahmedabad has improved by around 140% in the past 2 weeks, which is a good sign. Additional Chief Secretary Rajiv Kumar Gupta said the civic administration has asked 42 private hospitals to provide 50% beds for the treatment of COVID-19. The number of cases in the city continues to rise. The mortality rate in Ahmedabad is also highest in the state. So far, the city reported a total of 9,724 cases and 645 deaths due to COVID-19. Aparna Khun, AIR News, Ahmedabad.
Maharashtra recorded The Bombay High Court has said that the right to a decent burial is recognized as a facet of the right to life, and even in such a pandemic situation, this right cannot be taken away from any person. The division bench of Chief Justice Deepankar Datta and Justice S.S. Shinde dismissed a bunch of petitions challenging an April 9 circular issued by the Mumbai civic body designating 20 burial grounds and cemeteries in the city for disposing of bodies of persons who died due to COVID-19. More in this report.
The Bombay High Court noted that there is no scientific study or observation by the World Health Organization to show that novel coronavirus spreads through cadavers. The court rebuked the initial notification issued by the BMC, which said burial of bodies of COVID-19 patients would not be permitted and said the corporation's move to withdraw that circular and issue a fresh one is a timely move to restore sanity. The court ordered the civic body that proper management of disposal of dead bodies ought to have been worked out consistent with the recommendations of WHO and the Government of India guidelines, as well as the sentiments of the members of the communities for whom burial of a dead member is an integral part of their religious belief and faith. The High Court directed strict compliance of protective measures by state, BMC, families and second-line workers who deal with the cadaver. With Nivedita, Kunal Shinde, AIR News, Mumbai.
Maharashtra recorded 2,940 new coronavirus patients yesterday, which is the highest one-day spike so far. With this, the overall tally in the state has reached 44,582. On the first day of resumption of intra-district bus service in Maharashtra yesterday, only 11,151 passengers travelled by the buses of the Maharashtra State Road Transport Corporation. The state-run corporation operated 2,007 buses.
In Madhya Pradesh, the state government has started fever clinics to make screening facilities related to coronavirus more easily available to people. Additional Chief Secretary, Health, Mohammad Suleiman, said that the government is going to start fever clinics in every locality, ward and area, both in government and private sector. A report.
As per the official information, 1,391 fever clinics have started functioning in all districts of the state, where health checkup on 42,151 people has already been conducted. Of these, 30,555 people have been advised home isolation and samples of 6,050 people have been taken for corona test. Any person with symptoms of cold, cough, flu can go to the fever clinic and get their test done. Based on the investigation in the fever clinic, it can be sent to COVID Care Center. At the same time, the Social Justice and Disability Welfare Directorate have set up an 8-member cell to manage the homecoming of the Divyang and the elderly during the coronavirus outbreak in the state. Divyang and old age people can contact the control room of the Directorate on 0755 255 6916 for their problems. Sanjeev Sharma, AIR News, Bhopal.
In Uttar Pradesh, almost 85% of industrial units have started working again after opening up of economic activities by the state government. Minister of State for Industrial Development, Satish Mahana, said that production in these factories have started while maintaining social distancing, and rest of the 15% industrial units will soon start working in the state. A report.
Industrial Development Minister Satish Mahana said that while production units saw all-time low in the month of March and April, after second phase of lockdown, work again started in industries, and it is evident by the power load on industrial feeder also. He said that return of migrant workers from states like Punjab, Rajasthan, Haryana, Karnataka and Delhi has also gone in the favor of Uttar Pradesh, as industries here are getting more and more orders now. Citing the example of industrial units of a state who are producing spare parts of cycles and auto rickshaws, Mr. Mahana said that while production has not started in other states due to lack of the workers, now industries in UP are getting orders of such items. Some units are even getting 3 times extra order. He said that the state has started 21 online services for the benefit of investors during lockdown. Sushil Chandra Tiwari, AIR News, Lucknow.
In Karnataka, rural women's self-help groups formed under the National Rural Livelihood Mission have played a key role in COVID-19 pandemic containment measures launched by the state government. More from our correspondent.
The Gram Panchayats in Karnataka utilized the teamwork of 11,80,000 Sanjeevanis comprising of rural women to educate villagers about the pandemic and its prevention. The Mission Director of Karnataka Rural Livelihood Promotion Society Sanjeevani, Dr. Mamata B.R. spoke to AIR about the role played by groups of Sanjeevanis during the lockdown period in the state.
Around 30 lakh masks have been produced by our women, and around 100,000 liters of sanitizers have been produced. In addition to that, the Sanjeevani women have gone from door to door creating awareness about COVID and also informed authorities and Asha workers and Anganwadi workers of any newcomer coming into the village
Dr. Mamta informed that the rural women self-help groups managed community kitchens, distributed food packets and vegetables, and also conducted survey on the health status of family members in all the villages. Each member of the group earned between 500 to 800 rupees per day by selling masks and sanitizers to government departments, private retailers, and individuals. Sudhindra, AIR News, Bengaluru.
Tamil Nadu has recorded 786 new COVID-19 cases yesterday, surging the total tally to 14,753. Chennai alone recorded 569 new cases, taking the total number in the city to 9,364. 4 patients with comorbidity conditions died, taking the total fatalities to 98. 846 people have been discharged, leaving the active caseload at 7,524. More from our correspondent.
In yet another step towards relaxing the lockdown conditions, running auto and cycle rickshaws has been permitted outside Chennai city limits. However, the service is restricted to be from 7 a.m. to 7 p.m. for 12 hours a day. Even outside Chennai, the service would remain barred in containment areas. Those drivers living in such areas are not allowed to run them. Importantly, in an auto or cycle rickshaw, besides the driver, only one passenger is allowed to travel. The vehicle should carry hand sanitizers and the vehicle needs to be disinfected at least 3 times a day. It is said that gradually more such measures are set to be announced in the days to come. Jai Singh, AIR News, Chennai.
Now let's take a look at the weather forecast for today. National capital Delhi will witness minimum temperature of 25 degrees Celsius and maximum 45 degrees Celsius today. The capital city will experience another bout of heat wave. Mumbai will witness partly cloudy sky. Minimum temperature in the city will be 28 degrees Celsius. Maximum will remain around 35 degrees Celsius. In the south, Chennai will see a partly cloudy sky. Temperature will hover between 29 and 41 degrees Celsius. Kolkata will witness generally cloudy sky with light rain. The minimum temperature in the metropolis will witness 25 degrees Celsius, while maximum will be around 32 degrees. Onto the north, in the Union Territory of Jammu and Kashmir, Jammu will witness minimum temperature of 24 degrees Celsius, while maximum will be around 38 degrees Celsius. The city will observe partly cloudy sky. In Srinagar, minimum temperature will be 13 degrees Celsius, while maximum will be around 25 degrees. City will observe partly cloudy sky with 1 or 2 spells of rain or thunder showers. In Gilgit, temperature will hover between 14 and 28 degrees Celsius. There will be generally cloudy sky in the city. In Muzaffarabad, sky will be generally cloudy. It will witness minimum temperature of 15 degrees Celsius, while maximum temperature will be around 35 degrees Celsius. In Abu Dhabi, an Al Ain Zoo celebrated World Turtle Day to encourage the international humanitarian action to conserve and protect the oldest creatures on Earth, turtles. World Turtle Day is an annual event that has been taking place since the year 2000 and was founded by American Tortoise Rescue. The purpose of World Turtle Day is to educate people about how to protect turtle and tortoise habitats. Turtles can only crawl between 0.21 and 0.48 km per hour, but they can swim in water at speeds of up to 35 km per hour.
And now an overview of today's newspapers. PM hails Bibi for Ompun relief, grants 1,000 crore rupees, Odisha 500 crore rupees, writes the Pioneer. RBI predicts economy to shrink, cut key rate, headlines the Hindustan Times. The Tribune states, RBI slashes rates again to soften virus impact. City tax revenue doubles in 1 month due to liquor sale, VAT on fuel, reports the Times of India on the partial opening of the economy and levy of special corona fee on liquor having a positive impact in Delhi. Gurugram police suspends checking of movement passes at the border between 6 to 9 a.m. and 5 to 8 p.m. daily to prevent traffic congestion, notes the Hindustan Times on its front page. Healthy elderly can fly. Arogya Setu app not must for air travel. The Times of India quotes Aviation Minister Hardeep Singh Puri, also terming as impractical calls for quarantining domestic flyers after they disembark. And finally, the page 1 anchor in the Indian Express titled Girl Cycles Father 1200 kilometers to Bihar and Hope Follows carries the story of willpower of 15-year-old Jyoti. Cycling Federation of India Chairman Omkar Singh has invited Jyoti for a trial to ascertain if she can be groomed to pursue a career in cycling.
And now, before we end the bulletin, the headlines once again. Prime Minister Narendra Modi announces assistance of 1,000 crore rupees to West Bengal and 500 crore rupees to Odisha for relief and rehabilitation in cyclone-hit areas. COVID-19 recovery rate improves to 41% in the country. Government revises advisory to use hydroxychloroquine for asymptomatic healthcare and frontline workers. Air India resumes booking for domestic flights. ICSE remaining Class 10th and 12th board exams to be conducted from 1st to 14th July. And Community Radio Network to be expanded in the country, says Information and Broadcasting Minister Prakash Javadekar. With that, we end the morning news. Have a nice day.